Hey, welcome! Today, we're going to dive into a really complex topic, emotionally dysregulated personalities. And for this explainer, we're using the framework laid out in Chapter 12 of the Psychodynamic Diagnostic Manual, the PDM-3, which was edited by Vittorio Linghiardi and Nancy McWilliams.
So, to really get into this, I want to start with a question for you. Just think about a time when you've been completely overwhelmed by an emotion. Maybe anger or sadness or just pure anxiety. What does it actually feel like when that emotion just takes over and you feel like you can't find the brakes?
Well, for a lot of people, it's like being caught in a sudden, totally unpredictable emotional storm. One second, everything's fine, and the next, you're in the middle of a hurricane. And the source material points out that a huge part of this is having extreme difficulty with self-soothing. Finding that internal anchor to calm the storm down.
Okay, so when we're talking about psychology, the words we use, the names we give things are so important. It helps us get on the same page and really understand what we're dealing with. So let's look at the specific term the PDM-3 uses for this whole experience.
The official term here is emotionally dysregulated personality. And the definition is pretty straightforward. It's a personality style where emotions can spiral out of control really fast and without warning. But here's the crucial part, the note on the slide. The PDM-3 is very careful to distinguish this personality style from something broader called the borderline level of personality organization. That's a bigger category about overall psychological stability. This distinction helps us be way more precise.
So, if your internal world feels like a storm, you can just imagine what that does to your relationships, right? It makes navigating them incredibly intense and often, pretty chaotic. And this leads to a really central conflict.
And here it is, this impossible dilemma. On one hand, you have this absolutely terrifying fear of being abandoned, of being left alone or rejected. But on the other hand, there's an equally powerful terror of being engulfed, of being controlled or totally losing who you are in a relationship. You can see how that's a constant, painful push and pull. You can't get close, but you can't be alone.
So what does this conflict actually look like in real life? Well, it tends to create these really specific patterns. Relationships are often intense and pretty unstable, and there's this swing between two extremes. You idealize people when they're meeting your needs. They're perfect. They're saviors. But then, when they inevitably disappoint you or cause frustration, you completely devalue them.
All right, so that's the relational side of things. But let's turn inward now, because this storm doesn't just mess with how you connect with others, it fundamentally shapes how you relate to, yourself.
This quote from the source material is just so powerful. It really gets to the heart of this inner state. We're not just talking about feeling sad or a little lost. This is about a deep, persistent, painful feeling of inner emptiness, something that's often described as a void.
And this feeling of a void, in practice, it often shows up as this struggle to feel like you're the same person from one day to the next. You know that sense of continuity most of us have, that the you today is connected to the you from yesterday? That can feel like it's missing, which leads to this really fragmented experience of your own life. So when someone is trapped in an internal storm this powerful, how do they signal for help? This brings us to some of the most misunderstood parts of this personality style, the behaviors. And it's so helpful to reframe these, not as just symptoms, but as desperate flares being shot up from inside the storm.
Impulsivity is a really big part of this, and sometimes that can include acts of self-harm. But here's the thing we absolutely have to understand. These behaviors are almost never random. They serve a purpose. They have an underlying function.
These are actually desperate survival strategies. They can be a way to regulate emotional pain that feels just unbearable, to make that internal pain feel external, something you can see and manage. Or sometimes they're used to interrupt a feeling of total numbness, of dissociation, just to feel anything at all. And very often, they are a powerful nonverbal signal, a cry for help, and a desperate need for care.
So, we've got the emotional storm, the chaos in relationships, the behavioral flares. But what about the thought patterns that are fueling all of this? Think of it like trying to navigate that storm, but with a completely distorted map.
The PDM-3 points to a few key cognitive patterns here. There's a tendency to catastrophize, where a tiny setback feels like an absolute world-ending disaster. There's also difficulty with what psychologists call mentalizing, which is basically just accurately figuring out what other people are thinking and intending. This often leads to misinterpreting totally neutral things, like, say, a text that doesn't get an immediate reply as a profound personal rejection. And of course, that just kicks the emotional storm right back up again.
Okay, we have gone through the internal experience, the relationship patterns, the behavioral signals, all of it. So what's the big takeaway here? What does looking at this through the PDM-3 lens really give us?
And this is the most important point of all. A framework like this isn't just about slapping a label on someone. It's about providing a map to their internal world. It helps us understand the why behind what we see, the terrifying fears, that inner void, the desperate attempts to just stay afloat. And that understanding, that's always the first step toward empathy and actually helping.
So I want to leave you with this thought. It's a question that goes way beyond just this one topic. How does our entire perspective shift when we move from just judging a behavior on the surface to truly trying to understand the pain or the fear that might be driving it? Thanks so much for digging into this with me.